Hello, everyone, and welcome to the Down Syndrome Center podcast. As always, I am your host, Dr. Kishore Valodi, and today's podcast is one of my favorite ones to do because it came from your questions. Dear listeners, you are very active in sending me emails, and I think that's fantastic because as we get well above 200 podcasts here, it's hard to come up with topics on my own, and so you guys come up with them for me, and then I find speakers that are able to help answer the questions with me. So I have some really distinguished guests on the podcast with me today. I will have them introduce themselves, but Dr. Lauren Gist works at the University of California, San Diego, and is a developmental behavioral pediatrician and is the medical director at Rady Children's Hospital's Down Syndrome Center. So, Dr. Gist, thank you for joining us. And then Dr. Robyn Filipink is also on the podcast. She's been on our podcast before. She's a neurodevelopmental disabilities neurologist, and she actually leads our Down Syndrome Center efforts here in Pittsburgh in research in Down syndrome regression disorder. So, Dr. Gist, Lauren, if I can call you that on the podcast, go ahead and introduce yourself, who you are, and what you do that you'd like to add for our audience.
Great. So I'm Lauren Gist. As Kishore introduced me, I'm a developmental behavioral pediatrician. I spent about 10 years as a general pediatrician, and now I've been in developmental practice for, I guess, 15 years or so at this point. Running the Down Syndrome Center is my favorite part of my job. I'm mostly clinical, but I also get to be in a whole variety of different subspecialty clinics and just a general developmental peds clinic as well.
I love that. I love it. What was your thing that brought you to wanting to work with people with Down syndrome?
There's always a story, right? And so
Yeah.
I think my biggest story was when I was a young pediatrician. I had a patient who delivered a baby with Down syndrome in the middle of the night at home, and they came into my clinic. And it was a whole scary experience because really the baby needed to be in the hospital. But I think somehow that stuck in my mind. And so I've always been
Hmm.
interested in the Down syndrome community and supporting them. And then now I have a cousin who has a daughter with Down syndrome. So I think things just kind of
Wow.
snowball.
That's amazing. I love it. I love it. And then Dr. Philipping, Robyn, if you don't mind, I'll call you that during the podcast. Robyn, tell us a little bit about your background and why you love doing what you do.
Yeah, so I'm a pediatric trained neurologist, specialization in fellowship for neurodevelopmental disabilities. So I see kids with developmental and behavioral issues, children with many different genetic syndromes. And during my training, I work with Dr. Cohen, who started our Down syndrome clinic at Children's Hospital of Pittsburgh. So in my training, I saw children and adults with Down syndrome. So I really became connected to this patient population and to continue it. And so, working with a population where there are neurologic issues, including autism, epilepsy, and now Down syndrome regression disorder. So those are kind of my capsule interest. But serving populations that have special needs has really been, dear to my heart in my work. So that's where I come from.
I love it. I love it. In fact, when I started here over 20 years ago now at Children's Hospital of Pittsburgh, Dr. Cohen, who you were speaking about before, who had started the Down Syndrome Center, he says, "You've got to meet this Robyn Filipink." And that's how we met each other because he spoke so highly of you. So I am very, very glad to have both of you on the podcast to talk about this topic. Maybe, Robyn, can you just kick us off, as a neurologist, like
Yeah,
give us an idea of like what is folate and what is it used
sure.
for in our body?
Yeah, so folate is one of the vitamin Bs. So it's actually vitamin B9. And this is found naturally in foods such as beans and leafy greens. There is a synthetic form called folic acid, so different from folate, folic acid. And it was found that people could have deficiencies in folate that would lead to spina bifida, neurotube defects. So a long time ago, in order to fix that, folic acid, synthetic form of folate, vitamin B9, was fortified in food. So acid is in most foods that we have, certified in breads, certified in cereals. So most people are going to get folic acid because of supplementation that is just naturally found in the food that we have now. So again, folate is vitamin B9 found naturally in foods, and folic acid is the synthetic form that has been fortified in foods. Leucovorin is actually, so there are these pathways in the body where folate or folic acid is taken in. And through many different passages using what we call enzymes to break things down, there are many pathways that folate and folic acid will be combined or used in. And one of them is DNA synthesis. If you have problems bringing in folate or folic acid into these cycles, leucovorin is a form of folic acid, so a form of this synthetic form that comes in that is already broken down. So you can bypass the way it comes into the body by giving leucovorin. So it's a bypass product that is reduced and active. And so leucovorin is used in a couple of different areas of medicine. So when people are getting chemotherapy to treat cancer, leucovorin is given to protect cells. So what happens when you get something like methotrexate, which is a chemotherapy agent, it comes in to disrupt this pathway that helps with DNA synthesis. And that's the whole point, is because you want to kill cancer cells so they can't replicate. Well, the problem is this will hurt other cells in the body. So part of the treatment for someone being on chemotherapy, such as methotrexate, is leucovorin is given so that all the cells don't die and that they can actually replicate and keep growing. So leucovorin is commonly used in chemotherapy, and it can also help some chemotherapy agents be a little stronger. So those are the uses that we see mainly in medicine, and that's very, very important. And then there's another, to kind of give the bigger picture of why we're even talking about leucovorin now, is there is a very specific disorder called cerebral folate deficiency. And this is a genetic disorder that you can actually have genetic testing done to identify if you have it. And this disorder has to do with bringing that folate into the body, or folic acid into the body, and they can't bring it in to come into these pathways because there's a problem with the transporters, or you have antibodies that are stopping those natural forms and folic acid from coming into the body and helping with DNA synthesis. And when this can't happen, this is disrupting many things, including development. So persons with cerebral folate deficiency will have a couple of things. And it's important to understand, again, the picture of why we're talking about this. These children will start having developmental regression from 6 months to 2 years of age. They develop significant epilepsy. Their brain does not grow and it starts to shrink. It's called acquired microcephaly. They'll have difficulty moving their body, so their tone will be very floppy or very tight. Sleep gets disrupted. They can have vision changes, and they will eventually progress to having sensorineural hearing loss or becoming deaf. And you can see changes in the MRI that definitely can help diagnose this disorder. This disorder is diagnosed also by doing cerebral spinal fluid testing called the lumbar puncture, where you actually look at this 5-MTHFR that's in the cerebral spinal fluid, and it's very low. So we know that the pathway of bringing folate into the body is not working because you're not seeing this in the cerebral spinal fluid. And so this description of CFD, where children are developing and then start regressing in skills, people have saw similarities that, hey, this sounds like autism, where you're developing and then you have regression, you can lose some skills, but you'll see CFD has a lot more to it. You're losing tone, how the body is moving, you're losing hearing and vision, you're developing significant epilepsy. So there's a big difference between CFD and just autism. But many people started looking at, well, autism sounds like this, so can we start checking folate into the blood? But that is not the way that you can test for it. You have to really do CSF testing in order to really look at how the brain is bringing in this nutrient, or how it's not bringing in this nutrient.
And Robyn, that would include then having to do a lumbar puncture, like a spinal tap, to get the fluid.
Exactly.
Got it.
So you have to have this concern with, again, all these symptoms, not only regression, but seizures, MRI changes, tone changes, deafness, vision changes. And that brings the picture of this. And then testing, you can do genetic testing, you can do lumbar puncture testing, but most of the time you're going to have MRI findings. So again, there's some similarities with autism, but it is vastly different. And so studies started coming up many years ago of looking, well, can we treat, maybe they have a problem with folate because it's like CFD. And if we gave leucovorin, again, the reduced form of folic acid that is skipping the stages of how it gets into the body, can that be a way to treat autism? So this is kind of where we've developed, where there have been many studies coming along, purporting that there is big changes that we see in autism because now we're doing this pathway, this folate pathway, and adding an extra, bypassing a step and adding leucovorin to help this pathway along. So again, drawing some similarities to CFD, but is this a way to treat autism? So that's kind of just the background of why we even started talking about leucovorin as a treatment for possibly autism.
Thank you. Yeah. And Lauren, I was wondering if you might be able to help us to, I mean, from your perspective, as we think about how Robyn really just nicely kind of laid out the very specific times where we might use leucovorin and in a patient, whether it be chemotherapy related or whether it be because they have this very rare cerebral folate deficiency. What are your thoughts in terms of what have you seen in terms of claims and its use in autism? And is there any data that has been found to support this?
Yeah. Well, thanks for that question.
Yes.
I think there's lots of claims about how leucovorin may help symptoms that we see in people with autism. I mean, I think, this boils down to the challenge of we don't really have any treatments, medications particularly that address the core symptoms of autism, right? So deficits in social communication in particular, and also restrictive and repetitive behaviors. And so many of these studies, and there are really a handful of studies out there that are small and have some methodologic challenges that really look at kind of can we improve some of these symptoms. And so some of the claims that are made are improvements in verbal communication, receptive expressive language, attention, repetitive behaviors, some scores on specific testing, social interactions. So I think as you can see, these are very broad areas, and expecting that a medication is going to address all of those is quite lofty.
Mm.
And so it's been one of the big challenges that there are studies done in the US, a handful of relatively small double-blind studies, mostly out of one specific investigator. And then there are a couple studies, several studies done in different countries that look at leucovorin supplementation in autism and are, trying to see whether there is some kind of improvement. And I think there's so many challenges because they're all looking at different data points, and none of them have really enough power to give kind of concrete conclusions. And so while some of them may report that they are seeing some improvements, I think in going back and looking at the data, it's really hard to draw those conclusions ourselves when we're looking at whether or not we can recommend this kind of medication for children. Really, we're missing large scale studies to be able to give some kind of a quality evidence-based decision to our medication management.
Yeah, Lauren, thank you. I mean, you highlight so beautifully, like there really is nothing that is available to be able to treat in terms of a medication you can give to treat so many of the things that we see in autism, and certainly with our current climate, there has been a lot of push towards trying to make leucovorin seem like it would be the cure or miracle treatment for autism. I wonder, Lauren, if you wouldn't mind, just give us an idea of like very recently, there's been some changes in terms of recommendations for leucovorin in terms of from our FDA. Do you want to share that with us?
Yes. So I think there was a push from our government to use that perhaps leucovorin could be an FDA-approved treatment for autism. And so I think there was questions about whether that was going to be the case. In general, in order to make FDA approved medications, we have to have kind of large phase 3 trials that we don't have right now for leucovorin in autism. But actually what happened is most recently, while we've had leucovorin approved for specific chemotherapy or cancer and immunologic agents as something that we use in addition to for the exact reasons that Robyn was talking about. It's also approved for some specific anemias. It is now approved for cerebral folate deficiency as of last week, which is exactly what Robyn was talking about. But it is not yet FDA approved for autism. And we really don't have the evidence that we would expect for the FDA to come out with that kind of recommendation at this point in time.
Perfect. Thank you. Now, one thing is, as folks who take care of people with Down syndrome, with everybody on this podcast does, we know that many genes for folate are found on the 21st chromosome, and now we have, that in triplicate in our friends with Down syndrome, and so there has been, even in people without autism, there has been a little bit of an increase in the questions that I'll get, including the person who asked this for this podcast. What about using something like leucovorin in people with Down syndrome? Robyn, we'll start with you on this one. Is there any data to support the use of leucovorin in somebody with Down syndrome?
Not that I know of.
Yeah.
I just like to step back and say, anecdotal evidence, anecdotal stories really weigh on families. I heard that blank started leucovorin, and now they started talking, their behaviors improved. And that's really hard to address because it's very personal and you really want that for your child. And then we come in and say, hey, we want the evidence behind that, because I think that's really, we want to be able to recommend something that we know is going to bring to fruition something that's truly going to be a change. So, right. So there is not any evidence or any data to suggest that this would work in Down syndrome. And then you have to ask, in what are you looking for to change? The many of the studies, as Lauren was saying, have many issues with them. They come from mainly one lab. They're not double-blinded. And I like to just bring this up, that the one double-blinded study that they did do, that was done, was just retracted because of statistical error. So the one double-blinded study that was finally done, even though it had a very low N, meaning there weren't a lot of subjects, was retracted. So, a study with, some really, at least, had, double-blinded, that the gold standard that we use is no longer something that we can rely on. So, again, looking at the evidence in what we have, drawing conclusions of, hey, could this work in Down syndrome? Now, what I will say, and I will warn to this, is because of the government saying that this is something to treat autism, there has been a big national shortage. So persons who need this for chemotherapy, for megaloblastic anemia, they're also now at risk for not being able to have it. So I understand families who are like, well, I just want to try it. But as you're saying that, there's also people who really need it, and now there's a shortage, and they may not be able to get it. So we have to think about everything in kind of like the fuller picture, and want to use evidence-based medicine approaches when we make recommendations.
Thank you. And Lauren, I wanted to come back to you with that same kind of question, because, obviously when we're thinking of studies, especially in children, we want to make sure that the medication not only is effective, but that it's safe long term. And so as we think about some of these studies that have looked at maybe or even theorized about using leucovorin in Down syndrome, is there any data to show that it's effective or safe in the long term from what you've looked at?
Yeah, I think that's actually a really good question. And I'm not sure that I have all of the answers for that. But I think there are some studies of leucovorin use in Down syndrome. I think, we certainly have a lot of press about leucovorin right now, but the idea of using leucovorin for a variety of different reasons is not new. I mean, research has been going on for, 20, 30 years. Looking at this, not necessarily in the autism population, but for other reasons. We're always looking to repurpose medications. And I will say that there were a couple studies done in Europe, right, in young children, like infants and toddlers with Down syndrome, looking at kind of overall improvements in global development. And none of those showed any improvements. Kind of on your question a little bit about kind of safety data. So when we look at like adverse effects of leucovorin, it's a little challenging because most of the time leucovorin is used in addition to a chemotherapeutic agent, and we know there's a lot of side effects that go along with those medications. So when you look at an insert on, what are the side effects of leucovorin, they're often what we would expect with a chemotherapeutic agent. So hair loss is common, GI side effects like, nausea. And so those are the common side effects that we might see, some like mouth ulcers. And, I don't think we think that that's related to the leucovorin, but probably related to the chemotherapeutic agent. Hard to determine when you're using two different ones. I think some of these studies that have been out there have, not been safety studies, but have reported adverse effects. And I don't think we have really, clear evidence of what else might happen, but I think there has been some suggestion that there could be some other effects on perhaps like agitation, irritability, hyperactivity. There may be some side effects of leucovorin, and it's not entirely a benign medication that we, just give and don't worry about at all because oh, it's just a vitamin. I think that can often feel like, oh, it's no big deal. It's something that is natural, that exists in our body, and that there aren't big side effects. So I think we have to recognize that there absolutely can be adverse effects to medications, even if they are vitamins. And so we should, be wary and make sure that we're using them for intended purposes. And we don't have great data to support their use. It's hard to justify that.
Yeah.
And
So,
just to
yeah,
piggyback
go ahead,
on
Robyn.
that,
Mhm.
sorry, it's not over the counter. So you have to get a prescription for leucovorin. So this is not just a supplement like another vitamin D that you can get. There's actually a script that goes with it. So again, it was FDA approved because it's a medicine and not just a supplement.
So I will then ask, as we kind of get to the end of our podcast, each of you, so let's say theoretically you have, a family who has concern, or maybe their child has been diagnosed with autism and they have Down syndrome, and they come to you and they say, is there evidence base to use leucovorin that we can know that it's effective or safe for our child? Robyn, how would you respond at this current state of our understanding?
Yeah, so I usually will tell parents that there is something called cerebral folate deficiency where the leucovorin is absolutely a treatment. And if we have enough concerns, we definitely want to make sure that we're going to look for that. So any child diagnosed with autism should have a genetic evaluation. So that's the American Academy of Pediatrics. Everyone agrees with that. So we should never lose that piece. And through that evaluation with something called exome sequencing, you can identify this as an underlying genetic disorder. We never want to miss that piece. I would say the things that we know can be effective in treating autism, we never want to miss doing interventions, behavioral interventions, ABA, the things that we know can help, make sure they're getting speech therapy, all these other things that we should be surrounding the child with, making sure that we're not missing that piece. And then talking about leucovorin, that this is in the news, but we do not have evidence that it works. And one study that everyone was kind of using as, hey, this is a double-blinded study, has been retracted. So we don't have good data for it, even though there's anecdotal, and I know that anecdotal is strong, but right now we do not have a medicine, and I do not feel comfortable prescribing something that doesn't have any evidence behind it to do it. And I will say the FDA has said this, the American Academy of Pediatrics, the Society of Developmental and Behavioral Pediatrics, and Autism Speaks have all come out saying that we need more studies. We all agree we need more studies. We need thousands of kids in these studies, not 80 or 40. And we need to have double-blinded studies so that people don't know what they're getting in this study. And when we are putting the patients in it, we're stratifying what kind of autism they have, what are their genetics behind it, do they have Down syndrome or not, do they have this or not? So we understand the actual population that's being studied. And then we're using methods to actually look at behaviors that should be used in studies and not just ones that are used to help diagnose autism. And that's one of the big parts about research is when they're using, their behaviors improved. These are a lot of analysis to diagnose autism, but not to actually show behavioral changes in studies. So we want them to use good methodology. And then if that was the case, we would all be behind it. But right now we're not at that spot. But, we don't want to keep anything from a population that could, really benefit from it. But we want to do it in a very careful manner.
Great. Lauren, anything that you would add in your conversation with that family?
Well, I think I echo Robyn's, what she kind of reported. I say essentially the same thing. Like, my goal is to, be a partner, right? To walk with families and figure out how to support children in the best way that I can. And absolutely, we want to use evidence-based therapies in our children who have Down syndrome with autism and without. But we also want to be cautious and make sure that we are kind of using what we know has evidence and support. And then if we get more information over time, science evolves, our recommendations change. And so, there is always the potential that there will be new medications or other therapies that are developed. And so, that at that time, that's a different conversation that we can have. But at this point, I agree. There's not the evidence to recommend the use of leucovorin for autism, and certainly not, I think, Down syndrome alone without autism. And so it's just not something that I feel comfortable prescribing for families.
Awesome. Thank you both so much. I always want to make sure for our guests, is there anything else that you think, boy, that would be really important for us to cover? Do you feel like we've covered this topic fairly clearly? Lauren, what do you think? Are we anything we're leaving out?
No, I don't actually think that there's anything else that I don't think there's no one
Yeah.
has a magic ball, right? We don't have all of the answers for this as well. I just think we always, when we hear things, we just always have to go back to what evidence do we have and how do we get more evidence. And,
Yeah.
the stories, I agree, are so powerful. But I think also stories come out over time, and I think families are also having the experience that might have tried before that they aren't necessarily seeing the benefits that, they thought they might. So I think anecdotally things do change also.
Yeah.
It's hard. It's so hard. We all want to do what's
Yes.
the best for families.
hmm Robin, anything else that you would want to add for us?
Yeah, I just want to add two things
Yes,
because this
please.
comes up a lot when families are adding. Again, just checking folate levels in the blood is not a way to check for cerebral folate deficiency. And two, a lot of families will ask about the antibodies, these folate receptor antibodies. And I will speak to this. The research that has been published shows that 30 to 50% of typically developing kids have antibodies to folate receptors. So testing for folate antibodies or using it in research is not helpful at all because it's in the general population. And families should know that because a lot will come asking for antibody testing. The other thing that's really important is there is not a designated approved lab that will test for antibodies. So these are just some labs that will do that testing, but are not, officially approved to do it. So you send the antibodies, it's not an official lab that we recognize as being able to do that. So this is a question that families will come up with a lot. Can't you just order the antibodies and then we'll know to do leucovorin? And the answer is it's in the general population, pretty high,
Okay.
30 to 50 is very high.
That's super helpful to know. Okay, awesome. Well, thank you both. Oh my gosh, Dr. Filipink, Dr. Gist, thank you so much for joining me on this podcast today. It's been fantastic. I think our listener who asked this question is going to get all the information they could have wanted about this topic. And who knows, one day we'll do an update podcast if there is any data that can give us some real direction. But for now, I think we're stuck in we just don't have enough information in this population, which is an unfortunate thing that we say quite a bit. But the things are changing in the world of research in Down syndrome, and we will keep you updated as we get more information. For those of you who are like, boy, I wish I could ask a question to be answered on the podcast. Well, you can. You can send me an email at downsyndromecenter@chp.edu, and you can ask me any question you'd like. And if it's something we have not yet covered on this podcast, I will gladly find some guests to be able to answer the questions with me. And for those of you who want to be a part of what we do here at the center, including this podcast, please go to please go to givetochildrens.org/Down Syndrome Center. But until next time, bye-bye.